3.
Okay, just entered the hospital. When we enter the hospital for the first time, I always perform a full hand wash. So I've gone ahead and done that. I've checked my orders and my patient has a order for a dressing change on their abdominal incision every 3 days. It is day 3, so we're gonna go ahead and do that. I'm gonna gather my supplies. I've got a blanket, I've got a full dressing change kit, I've got a bottle of unexpired saline solution, I've got sterile gloves. So I've got all the things I need. I'm going to go ahead and check my patient and make sure that they don't have any pain at the incision site. If they do have pain, I'm going to go ahead and administer any pain meds as needed, like an hour before, so that they're in the most comfort possible when we do perform the dressing change procedure. So I would go ahead and do that. So we've done that about an hour ago, and now we're going to go and perform the dressing change. Alright, so knock. Hi, my name is Jay. I'm a student nurse from Mount St. Joseph University. How are you today? Good. Hand hygiene. Could you verify your full name and date of birth for me, please? Good deal. Checking the wristband. And do you have any drug allergies? No? Alright, well, the reason I'm here is I'm going to help your nurse with a dressing change on your abdominal window, alright? Do you have any pain at the incision site right now? No? Alright, good deal. Glad that medication is kicking in for you. I'm going to raise the bed up to a safe working height for myself. And I'm just going to drape this blanket over the patient so that they can have some privacy when we do examine their abdominal area. And now I'm going to start preparing my field of equipment. I'm going to don just clean gloves here. Before I do that, I'm just going to give a little wipe of the table to make sure it's nice and sterile. And now I'm going to start laying out the equipment in preparation for performing the dressing change. So I'm going to pull out this blue chuck, which will be the basis of my sterile field. I'm going to carefully lay that out, making sure to not go over top of it and not let it drape over the sides of the table. Go. We've got a red biohazard bag. This is what we're going to use to collect all the old dressing. So I'm just going to lay this at the patient's feet so it's ready when we do perform the dressing change. And now I'm going to take my equipment that's in the dressing change kit, and without touching any of it, I'm just going to dump it out onto my sterile field so it's ready for use. And then stuff that comes in packaging, like the sterile swabs, I'm going to go ahead and, without touching the swabs, open the packaging and dump them out onto my sterile field, disposing of the packaging. Go. And now I'm going to get my larger swabs out as well. Dump those straight out onto the packaging. There we go. Alright, and now I'm going to prepare my little basin of sterile solution. So I'm double checking that the sterile solution is not expired. It is not. So now I'm going to pour that out in here in preparation. And now I'm going to don clean gloves, keeping my eye always on the sterile field, performing hand hygiene. Donning some clean gloves. Alright, Mr. George Smith mannequin. I'm going to be removing the old dressing on your wound now, so you may feel a little discomfort, but let me know if there's too much pain, okay? So I'm going to examine the old dressing, carefully remove it. As I'm removing it, I'm assessing for the amount of discharge on the old dressing, any signs of infection, anything like that. I'm pulling the old gauze out. Again, assessing for any signs of infection, taking note of the color of the discharge, the amount of discharge, anything like that. Approximating the size and scope of the wound visually. So now I've done that, I'm going to remove my clean gloves. Always keeping an eye on my sterile field. Perform hand hygiene. And now I am going to don my sterile gloves. So I'm going to carefully open my sterile glove kit, taking care to only touch it by the borders and not go over top of it. I'm going to don my first glove by gripping by the cuff only. And then the second glove looping in to the cuff. Now, sterile to sterile, I can fix this glove. All right. Now I'm going to perform an assessment of the wound. So I am going to south away. Yeah, the middle of the package is sterile and I'm sterile, so I can grab that, get that on the floor. I'm going to grab my sterile ruler that was in my kit and a sterile swab. And go over, first approximating the length of the wound, which is about 14.5 centimeters, and then the width, approximately 2.5 centimeters, and then using the cotton tip applicator to assess the depth, about 2 centimeters. With the applicator that is now non-sterile, I'm also just checking for any signs of tunneling along the sides of the wound. That's all good. So the wound is looking nice and healthy with good defined borders, no signs of tunneling, and no signs of infection. So now I'm going to go ahead and proceed with packing the wound. I am going to grab my cotton swabs and using the sterile tweezers, dip them into the sterile solution, getting them nice and moist. Bringing it out so that it is moist, not too wet. And then I'm going to grab a fresh sterile applicator, throw it over here, and not touching the wound at all with my hands. I'm using the applicator to insert the first wet swab. This goes in the garbage. Oh, yeah. I just realized that before I would pack the wound, I would clean it, obviously. So, backing up a step, made a mistake. That's all right. Just removing this. So I almost forgot a step. I would clean the wound with the applicator. So, cleaning the wound, starting with the least infected or least basically you want to clean from clean to dirty, so you're not dragging any kind of pathogens into a cleaner part of the wound. So you assess the wound for that. In this case, I'm going to go down the center first, down the side, and then down the other side. Okay, so that's the cleaning step. We're now going back to the packing step. So I've got my moist gauze here. It's ready to roll. Again, using an applicator, not touching the wound itself, to pack the gauze. New applicator for every piece of moist gauze. All right, that's looking pretty full, pretty nicely packed. So now I'm going to go ahead and apply my first set of gauze pads. And then the large pad on top of that. And now I'm going to remove my sterile gloves, using sterile technique to remove the gloves. I'm going to perform hand hygiene. And now I'm going to don clean gloves. Now we're ready to tape the sides of the wound. Taping down, making sure as everything is nice and secure. May kind of have to wrestle with the tape a little bit because tape and gloves don't go together. All right, that's good. That's nicely sealed. And now, lastly, what I'm going to do is document on the bandage time, date, and my initials. I changed the wound. That was when dressing was changed. And now I can go ahead and reassess the patient's pain level. How are you feeling? How would you rate your pain on a scale of 1 to 10? Patient reports they're not in an undue amount of pain, so I can get them comfortable again. Remove the blanket. This is getting tied up, and this will go in the biohazard waste, not the normal trap. I'm going to make the patient comfortable. So maybe he wants his bed raised a little bit. We'll lower the bed down to safe position. All right, Mr. Smith, your call light is here if you need anything. If not, I'll be back in about an hour to check on you. Relax. All my supplies are getting thrown away in the garbage. I will perform hand hygiene, of course, after I get rid of my garbage. And then hand hygiene. All right, I'll be back in a little bit to check on you. Ensure patient privacy, closing the door. Okay, so now I'm just going to document what I did. I performed a dressing change as ordered on the 3rd day. I performed an assessment of the wound. The wound was approximately 14.5 centimeters long by 2.5 centimeters wide by 2 centimeters deep. There was no sign of eschar or slough or infection. The patient tolerated the procedure well, didn't report undue pain before or after the procedure. I applied 3 strips of moist gauze into the wound. I applied 2 pads on top of the wound and then a large pad on top of those. So everything that I used to pack the wound. And then that's it.